Health workers continue their protests today over unreleased benefits, and they also want Health Secretary Francisco Duque to be held accountable for his alleged mishandling of funds. Greg Gregorio now joins us live from Manila to give us more details on this. Greg, good afternoon. What do you have for us?
Charles, health workers from various hospitals in Metro Manila gathered in front of the DOH Central Office earlier today for their mass protest. They are calling for the immediate release of their benefits as provided under Bayanihan law. Health workers from Jose Reyes Memorial Hospital and San Lazaro Hospital marched along Rizal Avenue to converge with other health workers waiting in front of the DOH Central Office. Today is the first day after the deadline given by President Duterte for the Health Department to release special risk allowances of these health workers. The DOH earlier said that it has already downloaded 311 million pesos worth of funds to their regional units last week to pay for the SRA of 20,000 health workers. But health workers say this fund is not enough, as many of them have yet to receive their SRA for their service from December to June. Aside from the SRA, health workers are also calling for the immediate release of their meal, accommodation, and transportation allowances, as well as their active hazard duty pay. Filipino Nurses United questions why the DOH continuously say they are still looking for funds for these benefits when COAS recently flagged their budget utilization, including 11.9 billion pesos in unobligated funds. Alliance of Health Workers, meanwhile, say they are disappointed that President Duterte continues to defend Health Secretary Francisco Duque amid many complaints from the ground. They say Duque must be ousted from his post because of these lapses in releasing benefits of healthcare workers. They even brought a photo of Secretary Duque placed behind bars as a symbol of their call for accountability. But about 500 health workers were estimated to have joined protests earlier. They are composed of health workers who are off duty, those who came from the night shift, working half day, or those who filed for a leave. Some were also joining the protest while working from inside of their hospitals by wearing red armband. We were also able to speak with Health Undersecretary Leopoldo Vega earlier. He said they respect the right of these workers to air their grievances, but he explains about 400,000 health workers have already received their special risk allowance for January to June work. However, he admits that they still have a pending request of at least 200 million pesos for additional SRA-eligible health care workers. Charles, for now, Undersecretary Vega said they are looking for additional funds to pay for other benefits provided or promised to health workers. The official also pointed out that 11.9 billion peso brought up by the Filipino Nurses United have already been used by hospitals during the first trimester of this year. Charles?
Thanks for those updates and stay safe, Greg. That was Greg Gregorio reporting live from Manila.